Hello and welcome. You're watching a special broadcast. In the next half an hour, we will give you a 360-degree view of the situation in the country vis-a-vis the peak in cases of Covid-19, about the third wave of the infection, about herd immunity and the slow pace of vaccinations, something that is possibly affecting you as well. I'm Sneha Mordani. First up, as more and more people get the infection in the country, with India's R rate or reproductive rate at 1.44, questions are now being raised about whether we are arriving at herd immunity. What exactly is herd immunity, and is there any reason to be optimistic? Experts weigh in. Swathes of the Indian population, young and old, are down with COVID-19.
सब कुछ करिए ऐसा कि जिंदगी बच जाए या फिर खत्म कर दिया जहर देकर इंजेक्शन। जो हमारी माताएं बहनें जितनी एडमिट हैं उनको इंजेक्शन दिलवा दीजिए, मर जाए।
The exposure to the infection to SARS CoV-2 is at an all-time high, with the reproductive rate at a shocking 1.44% of the population, which means one infected patient is infecting 1.5 people. But are we headed towards herd immunity? And what is herd immunity to begin with? Herd immunity is achieved when a high enough proportion of the population is vaccinated against a disease or has been infected with the disease and developed antibodies against it. Any one infected person will have the opportunity to infect less than one other susceptible person, hence halting the spread. Sero surveys or antibody surveys in India across cities have shown a high exposure to infection. But experts believe that is not really translating to herd immunity. Delhi, for example, had shown extreme exposure to COVID-19. At levels safe to say the population was reaching herd immunity. But that wasn't the case.
We are seeing some people who are having infection again, who had got infection last year also. So it has to be looked at very carefully. I would say sero surveillance data are helpful, but they cannot really guide treatment to a large extent, because if we said the sero survey in Delhi showed that more than 50 to 60% people had already got infection, then that data would suggest that we are already achieving herd immunity, and we should not have seen so many cases in Delhi. So I think we need to be very careful how we interpret sero survey data.
In fact, the last sero survey done in India showed that more than 21% of India's adult population had been exposed to COVID-19. The Indian Council of Medical Research noted that 21.4% of more than 28,000 people surveyed above the age of 18 showed exposure to the virus. But it also said that a large part of the population is still vulnerable to COVID-19. This means we are still far from herd immunity.
Immunity is an elusive concept as of now, because most countries are seeing multiple waves. Some of them are even seeing fourth wave. What we need to ensure is we have battle-ready workforce that can immediately mount a response whenever there is a wave affecting the country. Also, we need to ensure that vaccination is the only weapon to ensure most people are protected, rather than assuming that people will attain herd immunity through the infection.
Worse, the virus is changing its form, and this makes experts feel that there should be no reliance on herd immunity from widespread infection.
The virus is changing its face. There are a number of mutants which are circulating, which are increasing, which may evade immunity. And so, again I say, because of all these things, it's very difficult to achieve herd immunity in India, and this virus is going to simmer for a long period of time with intermittent exacerbation from time to time.
Sero surveys and antibody surveys and reliance on these to gauge if a population has reached herd immunity is a flawed model, is what many medical experts are now saying. There are cases of reinfection as well. So what do we really have before us? What we have is the vaccination, and what we also have is adherence to COVID-appropriate behavior, which is going to keep us safe, at least to some extent. In New Delhi, Sneha Mordani for India Today. Expect a peak in India this week before the 7th of May, says a top panel of the head of the National COVID-19 Supermodel Committee. Naturally, after a peak, expect a decline in cases. So we can expect a decline in cases, is what Dr. Randeep Guleria is also saying, sometime towards the end of May. The government also says at the same time that different states are going to be peaking at different times, and also that a third wave is inevitable. The second wave of coronavirus has got a vice-like grip on India. The virus has become more contagious and is spreading like wildfire across the country. The one question we're all asking is, when will this end? When will we see the peak of the current wave, which then will be followed by a decline in cases?
I think we're already seeing that the peak has happened as far as the western part of India is concerned, with cases now stabilizing or declining in Maharashtra. Hopefully in the central part of India, that is in Delhi, Punjab and the surrounding states, in the next few days, hopefully in the next 2 weeks, it will stabilize and cases will start coming down.
Experts opine the exact date may be difficult to predict, as different states will reach their peak at different times.
If we talk of the second wave, like we saw in the first wave, there will be different parts of the country which will peak at different times.
Those predicting the trajectory of cases say a nationwide peak is expected by the 7th of May, and that there are chances of states peaking differently. That would explain a delay in decline in cases in those states.
The pandemic basically started in the state of Maharashtra. So Maharashtra is already in a decline. You will see that. Now other states started peaking a little bit later because the pandemic traveled across the country. So they will peak perhaps not next week, but the week after that. And a few states are still showing climbing up. So they will peak later still.
But that's not all. Top medical experts say even after the second wave, India will not have the liberty to be lax, and a third wave may be on its way. Well, the government is saying that it appears that western Indian states of Maharashtra have peaked already. Cases are now on the decline. But states in eastern India like Assam, Odisha and Bengal will likely peak in the next few days. Well, even if the peak is over and cases start to decline overall in the country, which is expected, is what Dr. Guleria says, there is a possibility of a third wave, going by the nature of how a virus essentially behaves. And we have to be prepared for the third wave. In New Delhi, Sneha Mordani for India Today. India now accounts for a quarter of the world's deaths owing to COVID-19. And these are statistics given out by the government of India. The actual figure is way higher. So why exactly is the second wave more lethal than the first one? The morgues are running full capacity. Patients dying of COVID-19. Patients dying of lack of access to health care. The statistics, mind-numbing. India's record is beyond dismal when it comes to the total number of deaths we have been recording in the second wave of the pandemic. There has been a 7-fold increase in deaths reported in the last 1 month in India. India has seen more than 50,000 deaths in the last 20 days alone. India Today's Data Intelligence Unit has found that if you take the 1st of May 2020 as the beginning of the first wave of the pandemic, the deaths reported on this day was 77. Compare this with 118 on the 1st of February 2021, considered the beginning of the second wave. What is the reason behind this?
This huge surge in cases, definitely one has to admit that there is some degree of decrease in the quality of care that is being provided because of the number of patients rushing into the emergency and doctors having a tough time. And that may also be affecting morbidity and mortality.
So are these deaths preventable, given that experts say there is nothing to show that any of the new variants are causing more severity? Yes, say experts.
Not relatively higher in terms of mortality rate. The numbers in absolute counts are simply astonishing. We simply cannot imagine the number of deaths we are seeing because most people are getting infected in a short span of time and they do not have the access to healthcare facilities when they deserve the most. As a result, we are seeing many preventable deaths because we simply cannot save them as we do not have enough outlets providing oxygen or medical care.
The government continues to derive solace from the fact that India's fatality percentage is below 2%. But if you look at the absolute numbers, consistently over a period of time, India is reporting more than 3,000 deaths. This translates roughly to about 125 deaths due to Covid-19 every single hour in the country. Sometimes even more than this. What's worse is that there is gross underreporting.
Underreporting of deaths is a worldwide problem and India is no exception. Access to COVID-19 testing is limited, especially in rural areas and in lower socio-economic groups. People might not have access to lab testing. If such people develop COVID-19 and die as a result, their death might not always get classified as COVID death.
A team at the Indian Institute of Science in Bangalore used a mathematical model to predict that about 4,04,000 deaths will occur by the 11th of June if the current trends continue. With inputs from India Today's Data Intelligence Unit, Sneha Mordani, India Today. Well, at a time when the government is trying to stem the surge in cases of COVID-19 by inoculating more and more people, the data is suggesting that the pace of vaccinations has actually slowed down in India. The vaccine against COVID-19 is giving millions across the world a shot at life. But for many Indians, getting a dose is a next to impossible task. There is shortage, there is wastage, and this is resulting in a drop in the average number of people getting vaccinated against COVID-19. After touching a peak of 42 lakh doses administered on a single day on the 2nd of April, it has been averaging 18 lakh doses a day in the week ending. There is shortage of doses of the vaccine in the country. This means that a lot many people are not even getting access to the first shot, in spite of all adults being eligible for the vaccine. What's also worse is that senior citizens and others who are in the vulnerable category are not even getting the second shot of the vaccine. And this shortage is expected to continue for a couple of more months. The pace will not pick up soon, as is evident. Adar Poonawalla, the CEO of Serum Institute of India, manufacturing Covishield, has said there is going to be a shortage till July this year. In addition, there is gross wastage of vaccines too. The government says that 3 lakh doses have been wasted so far. The maximum wastage of vaccines has been found in Tamil Nadu, Assam, Manipur and Haryana, among other states, according to the Ministry of Health and Family Welfare. A little more than 13 crore people have been partially vaccinated since the country's inoculation drive began on the 16th of January early this year. If the pace of vaccination continues the way it has been, it would take nearly 3 years to cover the entire country.
There is an acute shortage. I believe it is time that the government of India rethinks its policies on prioritizing the people. We have opened it to 18 plus, and maybe that is a policy we need to rethink at the moment. And we have to, the limited doses has to be administered first to the most vulnerable people. And such a reprioritization has to happen with immediate effect until we are able to ensure a minimum of 5 million doses on a regular basis.
As of the 4th of May, nearly 5.3 crore people above the age of 60 and the same number of people in the 45 to 60 age group have received the first dose of the vaccine. What it means is that 26% between 45 and 60 and 38% above the age of 60 have received at least one jab so far. For the age group of 45 or more, states have 94.47 lakh doses left as of now. UP, Maharashtra, Madhya Pradesh, Bihar and Haryana have the maximum number of doses in balance. Only 3.4 crore people in the country have received the double dose and are fully vaccinated. Considering the double dose began 28 days after the vaccination drive started, it would take around 10 years to fully vaccinate all the people at the current rate. Data shows that inoculation process has not been uniform across the country. So far, just 6.62 lakh or just 0.12% of the people in the age group of 18 to 44 have received their first dose. With Samrat Sharma, Sneha Mordani in Delhi for India Today. CT scans are being done en masse in the country given the delay in RT-PCR tests. There is panic and a sense of anxiety leading to more and more patients resorting to this medical tool. But doctors say this is going to do more damage than help us. We spoke to the experts who advise against overtreatment. CT scans now being done to detect Covid-19 and the presence of infection in lungs can do more harm than help. That is the word from top healthcare experts in India.
85% of people have mild illness. They don't need to get a CT scan done. Getting a CT scan done is actually causing a problem for them.
Dr. Guleria, among others, note a trend of increasing cases of people resorting to using CT scans. They say neither should patients resort to this test themselves, nor should doctors overprescribe it.
CT scan, we should understand, is not a substitute of RT-PCR. CT scan, it has its own role in management of COVID, and whenever prescribed by the doctor, it can also alter the management given to the patient by the doctor. So this is my appeal to the general masses. Don't get CT scan done on their own whims and fancies.
The scan may actually prove to be more harmful than help.
One issue is that people who have mild illness, suppose you have just in the first few days of illness, you just have fever, your saturation is well maintained, 97, 98, you really don't have much complaints. There is no need for getting a CT scan. You're actually, especially in the younger age group, a young person exposing a young person to a CT scan with its radiation risk is definitely not worth it, and therefore there's no point getting it done.
Even when there is a hospitalization, a chest X-ray should be the first option and not a scan.
I think we must remember that the diagnostic modality of choice is still is not HRCT but RT-PCR, and only in few circumstances where we need to look at the lung lesions where COVID test may be negative do we order HRCTs.
So are CT scans good or bad, and should they be done? Yes, only if the doctor advises it. Only if the patient is in a hospital setting or about to be admitted. Mostly required if the patient is moderately or severely ill and not when the infection is mild. Not to detect the infection, and it's not a diagnostic tool. It's not to be done indiscriminately. The risks are exposure to radiation. Radiation can lead to cancer. The exposure to radiation from one CT scan is equivalent to exposure of 300 X-rays. Further, the government has also asked not to go for blood tests to spot biomarkers like CRP, D-dimer, if one has oxygen level at acceptable limits, which is above 94 and is asymptomatic. If you have classic symptoms of COVID, you're feeling unwell and you have done a test and you're awaiting the results, or even if you've got the results of an RT-PCR test and you're showing up negative, then you must not go for a CT scan. Because remember, even asymptomatic patients, experts are saying, will have some patches in the lungs if you're diagnosed with COVID-19. In such a scenario, a CT scan is actually just unnecessary, even counterproductive. In New Delhi, Sneha Mordani for India Today. Also, I spoke with Dr. Randeep Guleria, he is the member of India's task force and also the head of Delhi's prestigious All India Institute of Medical Sciences. Here he answered some very frequently asked questions about COVID-19. Dr. Guleria, A lot of people now are waiting for negative RT-PCR tests after being tested positive for 14 days, 20 days. There is pressure on the system. Is a negative RT-PCR test even required, or is that something that can be done away with?
The guidelines are very clear that for patients who have mild disease or who are asymptomatic, if you have crossed 10 days of having no symptoms, if you're asymptomatic, or you've crossed 10 days and you've had no fever for the last 3 days, then you are non-infectious, you can go out, you don't need to get yourself tested. Only those people whose immunity is low, who are on immunosuppressants, who are on regular chronic dialysis or such thing, there the virus can stay for a longer time, and then after 2 weeks you may get yourself tested.
There is already pressure on the system. A suggestion from the Lancet Commission task force is that states should not be pressurizing the people coming into when there is interstate travel to get a negative RT-PCR test. You think that's a valid suggestion?
I think it's a very valid suggestion. The virus is now having widespread community transmission. Now having these things are actually irrelevant. Therefore, asking people to get a test done before coming is of not much use. And we must understand that many people may be in the incubation period. They may be carrying the virus. Their test may be negative right now, but they may become positive 3 or 4 days later. And by that time, they would have been inside the state and would be positive and infectious.
To Galeria, lots of questions being asked about high-rise apartments and how there is a possibility that the virus is in the fecal matter. Is the virus in our sewage, and is that a reason why apartments are seeing a major spike in cases?
So I don't think the virus has been picked up in fecal matter, and there's no doubt about that. But the virus does not transmit through that route. So fecal-oral route is not a mode of transmission. It's usually aerosol. Apartments are seeing this because very often they have a common lift or common staircase. And if you have a person who is in that lift and who is sneezing or is coughing, he may release the virus in that, let's say, environment, which is a closed environment. And if someone gets into the lift later on, maybe about 5 minutes later, he may feel he's all alone and he may not be wearing his mask. He could get infected there. So it's important to understand that since this virus is not only a droplet infection, it's also an aerosol infection. It can stay in the environment for quite some time, especially if the ventilation is not good. And you may come into an area where you may feel that there is no one around you and therefore you are protected, but the virus may still be sort of in the air. And therefore, you could get the infection if you're not having COVID-appropriate behavior.
That's it from me for the moment. You can find details of these stories and much more on our website as well. It is indiatoday.in. You can also download the app. Thanks for watching.